Welcome everyone to this webinar hosted by the Latino Physicians of Utah. I am Dr. Capella, a pediatrician in Salt Lake City and also one of the board members of LPOU, and I am joined today by Alba Trejo Rosas. She is a physician assistant that works for the University of Utah, and we're excited to talk about becoming a physician assistant. I've spoken before on the process of becoming a physician, but today she's going to shed light on the process of becoming a PA, because both of those are really wonderful paths to enter into the field of becoming a healthcare provider. And in medicine, we all work as a team. So whether you're a nurse or a respiratory therapist, a medical assistant, a nurse practitioner, a PA, a physician, a surgical technician, we all work as a team to take care of patients on a day-to-day basis. So thank you, Alba, for being here. And I'll turn the time over to you. Go ahead and introduce yourself and what you do.
Of course, happy to be here. Good morning. My name is Alba. I am a physician assistant in the HIV clinic within the infectious disease division at the University of Utah. I've been there for almost 8 years. Prior to that, I worked as a critical care respiratory therapist for about 7 years. So it's been a while since I've gone through this process, but I reached out to people that I know um, went through it not so long ago and are currently going through it. Um, so let's get started. So we're going to go over the role of a physician assistant, education, experience, and application tips. So actually, the name for physician assistant changed to physician associate in the past 2 years because associate encompasses more of what the role of a PA is, because they are able to see, treat, diagnose, and manage patients and not just an extension of the DO or the MD. So the profession came about in 1967, and this was at Duke University by Dr. Eugene Steed. He selected corpsmen to be part of this accelerated medical program. And 2 years later, they graduated, and that was the first PA class in 1967. PAs are licensed clinicians that are practicing in all specialties and all settings. Currently, there's about 190,000 PAs working in the States. PAs can also practice internationally if they choose that path. Those countries are the Netherlands, the United Kingdom, and Australia and Canada. And overall, PAs improve access to healthcare. So let's go through the path that it takes to become a physician assistant. So these are the three main criteria. So PA, excuse me, your pre-PA education. So you're going to need a bachelor's degree to apply for to a PA program. And you can really do any degree, but there's some pros and cons to each. So if you do a science-based degree, such as biology, health science, or chemistry, that's going to help check off the prereqs that many of these PA programs require. And if you go with a clinical degree, like a PT, a RN, or an RT, that's going to help you accomplish your clinical hours. And then later on, you're going to have to work on those prereqs. And then the other option is you could choose to do whatever degree you choose to, as long as you meet those clinical hour requirements and your prereqs. It's important in undergrad to maintain a strong overall GPA. Anatomy and physiology are heavily reviewed, so make sure that you give yourself enough time to plan time to succeed in these programs. Okay. So the other part is clinical hours. So most programs, the minimum is 2,000, but to even be competitive, you should have 4,000 hours. I know that currently at the University of Utah, you get priority if you have up to 10,000 hours. So that's a lot of hours. So you need to start early. So use your summers to volunteer so you can secure those hours as soon as possible and try to take it as a full-time job, getting those hours, volunteering, and school, because that's going to set you apart when it comes time to apply. So did you have a question?
Yeah, I have a question. So I'm curious. I mean, when I'm looking at applicants to medical school, it takes, about a year or so to get 1,000 hours if you're working, somewhere like moderate to full time. And then if you're looking at 4,000 hours, that means that you're taking either a couple of years of work experience. Is that what you're seeing mostly in people who are applying to PA school, that they have a couple of like maybe gap years, or that they've balanced part-time school with part-time work for an extended period of time?
Yes, correct. So that's more of like when I applied to school, they weren't the majority of my class hadn't just finished up undergrad. There
Mhm.
had been like my career in respiratory care was 7 years.
Oh, wow.
Um, so you really have to plan ahead if you want to go from undergrad straight to PA school to get those
Mhm.
clinical hours. Start early, and it's not too late. Just start early,
Mhm.
um, or reach out. I know that I get emails from pre-PA students that want to shadow.
Mhm.
Reach out several times because sometimes we miss those emails. But yeah, this is a huge part of applying to PA school is having that experience.
Mhm.
So,
Got it. Thank you.
um, yeah. So ways that you can gain clinical hours is you could get a certification. And so you're getting paid and you're getting clinical hours as a EMT, a CNA, or a MA. And with these certifications, it can lead for you to um, have a higher pay, a little bit more flexible with hours if you need to finish up those prereqs. And it also offsets the cost of applying to PA school because the average right now is around 50 to 2,000, $500 to $2,000 just to apply. And then if you are invited for an interview, you have to account for the travel to get to the interview. If you're busy and you don't have time for a certification, there's other ways that you can get those clinical hours. You can be a psych tech, a physical therapy aide, a phlebotomist. For phlebotomists, there usually is on-the-job training. A patient sitter, this is when patients aren't able, should not be alone in a room and you accompany them throughout the day. And shadowing a PA. What questions do we have up until now? None. Oh, Jess?
Sorry, question. So my background is in pharmacy. So I'm a pharmacy tech in ambulatory care at the University of Utah. So we do a lot of focused patient care, especially for diabetes and hypertension. And so when I applied, I used those hours. And then I also have shadowed a DO just because he has a lot more um access schedule wise to have shadow versus some of the PAs that I work with in my clinic.
Mm-hmm.
So, do you have any suggestions like for me? Because I'm more medicine based, even though I do have a lot of patient care, I do a lot of like patient education, especially with CGMs and glucometer training. Um, I know
I
it's a little different. So,
so do you with those trainings, are you face to face?
yes. So
Yeah.
I do a lot of face to face, and then I do phone call follow ups too with patients with gathering information and stuff. So it's not so face to face with that. So it's kind of like a hybrid of what I do in clinic.
Okay. So definitely use those face to face hours as part of your
Okay.
um clinical hours. And then depending on the school that you want to apply to is on my slide here. For your volunteer hours or your shadowing hours, tailor that to the mission statement that you want to apply
Oh,
to.
okay.
So, for example, I graduated from the University of Utah, the PA program. So they are very focused on underserved communities. So you want to demonstrate that that is also something that you would like to do. In the Valley, there's like the Malahay Clinic, and there's other free clinics where you can sign up for some hours, and then that will add up your clinics that your hours that you're achieving at work and then outside of work.
Perfect. Thank you. I appreciate that.
I would also recommend, I know that you said that the PAs are their schedule's a little bit harder, but definitely shadowing a PA.
I know they see a lot more patients than our MDs and DOs, so like I understand it's like quite a bit more hectic for them work-wise than anything else. So, okay, I will keep that in mind. Thank you.
Yeah, no problem.
I'll also add something. That was a great question. Even though I'm in the med school admissions world, there's a lot of overlap, right? These admissions committees, because whether you're a physician associate or a physician, you're seeing patients day to day, right? You're having those clinical encounters. And one of the things that these admissions committees ask themselves is, do you have enough experience working face to face with patients to know that you like it and to know kind of what the job is really going to entail? And so that seemed like a great experience to me. If you're doing a lot of diabetes education, that is a lot of what you're going to be doing as a physician, is that face-to-face interaction. So I think absolutely echoing what Alba says, that it shows clinical experience. And as long as you're able to talk about it and talk about what you've learned through that experience and how it relates to your future career as a PA, I think that's fantastic. Of course, maybe mixed with other ones. You mentioned the Malihe Clinic in Mill Creek, I believe, and then a
Yeah.
lot of students volunteer at the 4th Street Clinic, and there are a couple of others as well. So great question. We also have a question from Elizabeth. She says, when someone shadows you, what is the most important topic to talk to you about? Or like, how should they interact? What do you like to see from students who are shadowing you?
I like questions, that curiosity to come across, and you're new to the field in the PA world, so just ask questions to get familiar what the role is. So like Dr. Capella said, you know that this is something that you want to do. And maybe you shadow a couple of days, just because every day is a little bit different, and some days might be really busy and some days might be really calm.
Mhm. Yeah, I would echo that. When I have students shadow me, I like to see that curiosity. And it's really hard because I'm naturally a shy person. And I think back to when I was shadowing, like back when I was 20 years old, or, in my early 20s. And I was probably quieter than was ideal. And I think it's really easy now that I have students shadow me, I see the difference of how it comes across from the attending's perspective. But when a student is too shy or too quiet, it can actually come across as disinterest. Like, I'm just
Mhm.
here to get my hours to check off a box, but I'm not really interested in your job or what you're doing or the patient's concerns or learning. But then there's also a sweet spot because I have other students who are very extroverted and very talkative. And then they're peppering me with questions. And I'm like, oh, shoot, like I really have to, like, I
Yeah.
have to hurry because I also have to see these patients. So there's kind of a balance. You don't want to be totally quiet. You want to ask questions that demonstrate curiosity, whether it's about the conditions you're seeing or the person's job or the behind the scenes or anything like that. But you don't want to be interrupting with so many questions that the PA or the physician, in whichever case it is like, oh my gosh, like I gotta get going, and the student is asking so many questions,
Mhm.
can't balance my job with the shadowing. So yeah, I think that there's that sweet spot, but definitely showing curiosity is the way to go.
I would also add that, like you said, that you see the behind the scenes, because
Mhm.
typically we're just the patient interaction, but you see the behind the scenes, and a lot of that those things we don't go over in school. So it's nice to see that when you're shadowing as well.
Yeah, and there's a lot of behind the scenes, like, oh, this. how do you know if the person's insurance is going to cover the medication, or where can they go to do that? There's a lot of
Mhm.
that goes on. Yeah.
Yeah.
All right, you can go ahead.
All right. So, going back to researching the schools that you want to apply to, look at those mission statements and see which ones align with what you would like to do. Right. Currently, there is over like 320 accredited programs. Um, so choose on if you want to move, the mission statement, your prereqs, and that way you can make your experiences relevant to that program, which is going to strengthen your application. Okay, you've done your academic part, you've done your clinical hours. Now you're going to apply to PA school. So I recommend starting early and being proactive. So CASPA, this is an online portal that streamlines the application process. So make sure that you create your account and you familiarize yourself with it. Um, in that one, each school is going to tell you specifically what is required to apply to that program. Every school is different and have different requirements, so make sure that you're careful in reading through all the requirements. There's a good site. It's the PAEA, and I put it at the end of the presentation. That one provides a application cycle, so you know when you should be applying. And sometimes there's a rolling application, so apply early, even if the deadline is still far out, because they'll look at the applications as they come in. So another part about getting into PA school are these entrance exams. So this is a little different from when I applied. The GRE, so you need to look at those. This is going to be a test that is going to look at quantitative reasoning, verbal reasoning, and analytical writing. The newest test is the PA CAT. So this is science-based. It's going to look at anatomy, physiology, biology, chemistry, and behavioral sciences. And the CASPER. So this is a situational test that looks at a situational exam test that is assessing non-cognitive skills like empathy, ethics, and problem solving. And it's not always medically related. It could be like you're in a diner and you see that someone, I don't know, takes one of the customer's purse, or how do you react to that? Or a situation similar to that. So it's not always medically related.
Yeah, they do that Casper test for medical school too. And I've talked to a lot of students after they take it. It's a lot of non-medical situations. And really it's
Mhm.
trying to assess you, because we know that intelligence is important, right? To be able to study well, to learn, to pass your exams in PA school. But the emotional intelligence of being a provider or clinician is just as important as the intellectual ability. And so more schools, whether it's medical school or PA school, are using these tests to assess your critical thinking and your emotional intelligence, essentially, because we know that that's so important to patient
Mhm.
interactions. You could be the smartest PA or the smartest physician on earth, but have a terrible bedside manner.
Mhm.
And most of us know that that's not an ideal, patient provider relationship. And so those tests, they're a little tricky to study for, but there are examples online that you can use to practice with and to get a little bit more comfortable with it. If you're a person that you feel like you have good people skills, with a little bit of practice, you can do really well on that sort of exam. The key is also to practice and not to overthink it. Alba, I also wanted to take a pause. We have some questions in the comments.
Okay.
So Elizabeth was asking, what's the biggest difference between when you started as a PA to now in terms of how PAs are viewed as part of the primary medical team?
I don't think there's been I think we've been when I started, so that was 2018. I think I was always seen as part of the medical team. I have always worked with my attending, but I have my own patient panel. Maybe in other clinics, they have now incorporated that the PA see their own patient panel rather than the PA seeing the patient first and then the MD or DO coming in. So I think we're moving more towards seeing our own patients, of course, with our attending around to ask questions that may come up.
Mhm. And then another question was, how many schools did you apply to when you applied?
I have the first year, hmm, this is, excuse me, this is like a big change. So my first year, I applied to two schools. I know it was Stanford and I want to say University of Washington. I got an interview to Stanford and I didn't get in. Um, and if you don't get in, it's heartbreaking. You're like, they
Mhm.
don't like me. They like my application, but they don't like me.
Mhm.
It's normal to feel that way, but don't take it too personal. Um, the second year, I actually just applied to the U, and I was lucky enough to get in
Mhm.
because one of my good PA friends, they applied to 20 schools, and a lot of people are applying to that many schools because it's so competitive. I would say really pick your top choices so you can really invest that time um, to be a good candidate. And you can have like some secondary schools that you'd be willing to go to.
Mhm.
But
Yeah, that's, oh, go ahead.
I'd say don't apply more to like 12 or 15 schools because as I said, it's expensive and there's different fees for each school.
Yeah, I like what you said about just make sure you're a strong candidate. I see this a lot in medical school applications where people, it's interesting because I have students who I mentor, some of them are really overconfident and they're like, oh, yeah, I'm going to apply to like Harvard and to Georgetown and to, all these like, higher up top tier schools. And then when they don't get interviews, they're just heartbroken and then they end up having to apply again the next year and spend another $2,000 applying. And don't put yourself in that position. Like if you're going to apply to those top tier schools, make sure that you are a strong candidate, that you have not just checked all the boxes, but just really prepared yourself for the process financially, um, educationally, and work wise. But if you're maybe like, somewhere in the moderate end of the pool and maybe you're like, well, I'm not the strongest candidate, but I know that I've done as much as I can do and you're ready to apply, then don't just apply to 20, 30 schools like Alva says, but choose
Mhm.
strategically. So choose maybe some dream schools and then choose some more like, within your range of scores and GPA schools. And then, but make sure that all of those schools are schools you'd actually be willing to go to, because if you're just applying across the board and you're applying to some school in Minnesota, but you would never want to live in Minnesota, then don't waste your money, right? Unless you're
Yeah.
truly willing to go there if that was the only option, right?
Mhm. Agreed. Yeah. Any other questions that were in the chat?
Let me see. There's another one. Apart from the mission statement, what is another element to focus on that can help me decide if the school will be a good fit? Do we need to travel to campus to decide, or just how does she get to know whether the school is a good fit for her?
I wouldn't I wouldn't recommend traveling to campus. I don't think that you're going to gain much information there. I would say like reach out to previous students. So like on my profile at the U, it says where I graduated from. I know that's going to take a long time, but or if you know a friend of a friend that went there, um apply to those schools. Another thing that came to mind, sometimes some of the schools are very GPA oriented and not so much clinical hours. So when I was applying, I knew that I wanted to be in a program that is more that clinical hours were weighed more because that way I'm going to be surrounded by classmates that also have a similar experience and we can learn from each other. Compared to a GPA, a program, which, maybe they don't have that much clinical experience. So that's what I was kind of looking at. So that might be a factor too when you're trying to decide what school to apply to.
Yeah, great questions, Elizabeth. Thank you for your participation.
Do you have any suggestions on that other than the mission statement?
Mhm. I'd say I like your idea of just trying to get to know people who have gone there, or maybe just, we live in the internet age. There's a lot out there.
Mm-hmm.
I know that there are, at least in the medical school world, there are students who have Instagram accounts that kind of like talk about what the experience going through medical school is like. I'm sure that if you look around, there are some PA students who are doing similar things. But I think really looking at their website can give you a pretty good, not just their mission statement, what kind of conferences does the school host? What kind of events? What do they have an affiliation with a free clinic in their community? Do they have special programs that focus on either particular specialties or rural medicine or underserved medicine? Like that's how you can kind of get a feel for the school. Look at what kind of student organizations they have, right? And so all of those things together can help you get an idea of whether that school has opportunities and education that is aligned with your goals or your, the things that are important about the culture of the school that are important to you. But if at all possible, try to connect with students at the school. Maybe they have a chapter of, I know in medical school, they have, for example, like a Latino medical student organization. Maybe they have something that's similar to that in PA school, and you can reach out to the president of that club or that student group and try to get connections there.
Yeah, I think there's like a pre-PA program. The other thing that came to mind, there is a website, it's called AAPA. It's at the end of the presentation. They have a where you could request a mentor. So, and that could be across anywhere, like if you're applying, if you're doing your clinical rotations. So that could be a good resource as well. Okay. Your personal statement. Like if everything else wasn't as important, we come to the personal statement where this is your ticket to the interview. So this is where you want to make them want to meet you. Um, Sometimes it's hard to start writing. I know it was for me. So just jot down ideas as it comes. You don't have to sit down and write it all out. Just jot down ideas, get um, your mind flowing. Give yourself time. Um, if you're gonna write this overnight, you're probably not gonna be a strong candidate. And like I said again, make it align with the mission statement. But the most important thing is make it personal. And instead of telling, like, I worked with an underserved community or underserved patients, show them how you did. Tell them a story of how you got that experience. And then, like when you're applying for a job, you want to grab their attention. So a good hook, um, I've heard that some people use lyrics to a song. As long as it is relevant to your personal statement, that would be a good hook, and you want a solid conclusion.
I will
Uh,
add, I'll add here a resource. So we recorded a webinar previously, and I'm putting the link in the comments on how to write a great personal statement. I think the principles are the same, whether you're applying to PA school or medical school. You want to make it story-based. You want to make it interesting and engaging. You want to really tell your why for why you want to be a PA, as well as those things that Alba mentioned. So we have that video on our Latino Physicians of Utah YouTube channel. You can find that there. And I went through and practiced with the student. I said, okay, tell me just off the cuff, like, why do you want to be a doctor? And then based on that conversation, I helped him like outline his personal statement. And so that's kind of an example of how you can do it for yourself, how you can use AI tools. We also talked about that, but how to use them responsibly when helping you with a statement. Yeah, so just wanted to put a plug for that video there.
Yes, that sounds great. Also, there is a do's and don'ts about your personal statement through the AAPA that you can take a look at, and it's also a good resource. Let's see. Trying, oh, there we go. So the PA programs, um, in order to practice as a PA, you have to have a master's level. So that's a standard education path and mirrors the medical model. Average PA programs are about 27 months, with the first year being didactic, and the second year being clinical rotations. The didactic year is going to be a full-time job, 8 to 5, Monday through Friday, typically with tests every week. So that is, it is stressful, but you can do it. And then after that, then you start your clinical rotations. There's the core clinical rotations, and then you also get to do electives if you wish. So you need a MPAS, the master's degree in order to do your boards, which is the PANCE. And you need your PANCE to do your licensure. The overall cost of PA school is about, it kind of depends, about 50 to 100K plus, because you have to account, yes, for the educational costs, but for the cost of living. So I did not work during PA school, so I had to take out money for my living expenses. So you have to think about that too. Um, if you're going to stay in state or out of state, things might look differently. Then most recently, there's a doctoral level. But this does not change the core duties of a PA. This is after you got your master's degree and you're more interested in career development, leadership, or education. This is an academic credential that you can do. And the cost is usually 15,000 to 50,000 for the entire program. What questions? Oh, go ahead.
There was a question from Elizabeth. She says, I'm wondering, going back to a comment you made earlier, you mentioned that it was heartbreaking, but you didn't get in the first round and then you reapplied and got in. What is it that you prioritized during that reapplication cycle to make yourself more successful the second time?
My personal statement. So my personal statement, and then interviewing is the interviewing process. I practice. So I would have my friends or my siblings interview me. I would give them a list of questions to interview me. I would interview, I would ask questions by myself and put like some target points in your room, like I don't know, a teddy bear here, a teddy bear there, just to make sure that you're making eye contact with everyone. So really it's a lot, but trying to hone in your interviewing skills. I am also a very shy, reserved person, so it took a lot. So practicing the interviewing, I think, is really important.
Yeah, I would echo that because, I when you talk about you got an interview at Stanford, so they liked you, but maybe not as a person, that's a little harsh on yourself. But I think you maybe they did like you, but once you get to the interview level, it's very competitive because they've already chosen like the top. And so they're really, when I served on admissions committees, sometimes we were getting really nitpicky at that level. And so even just like whether you were able to carry yourself with confidence, whether you're able to communicate clearly and articulately, whether, those little things are the things that they're going to nitpick at the point where you get to the interview level. So I would echo exactly what you said. When I mentor students applying to medical school, we have a whole application coaching program and we practice every month for an hour and a half to 2 hours interview skills for a few months leading up to their first interviews, because it's so important, and it seems a lot easier than it is. Like, you might watch videos, you might
Mhm.
read articles about what to do, and you're like, okay, I got it, I got it, I got it. And then suddenly, when you are in front of that camera, if it's a virtual interview, or in front of that person, if it's a real life interview, I mean, you can suddenly enter panic mode, and all of a sudden, all of the things that you thought you knew just go out the window. So that practice, I tell students when I practice with them, I said, I'm prac I want you to tell yourself, I'm getting comfortable being uncomfortable. It's not
Mhm.
about the words that come out of your mouth. It's not about the exact responses to the questions. It's about getting comfortable being uncomfortable. And the more comfortable you get being in that hot seat, the more natural you're going to come across on interview day. And that naturalness really makes a difference in how you present yourself.
Yeah, try not to be too rehearsed.
Yes.
Um, I, when I did my interview process, I got a question completely out of the blue, and I think it was because I was a little bit too rehearsed. So finding that sweet spot where you come across natural. Like I was asked, "What makes you laugh?" I was like, what makes me laugh? And then you're in the hot seat and you're like, I'm like, if someone falls, like how is that, So sometimes if you're too rehearsed, you might get those questions. So trying to find that middle ground.
Absolutely.
All right. Any questions on the PA programs? So really, to be a practicing PA, you have to do the master's level. And if you want to focus on more leadership roles, then you could do the doctorate. But your ability to practice um, does does not change with a doctorate. The duties do not change with a doctorate degree.
You mentioned that you didn't work through that first year, which, I mean, it sounds like it would be very hard to work because you're taking classes 8 to 5, Monday through Friday. Is that generally the rule that most students through PA school are not working? I know that that's true for medical school. I would assume that most people are not able to balance a job.
That is true for the majority of patients. There was one student working night shifts, but they were a medical doctor in their home country. So it would be a little bit easier for them.
Oh
But
yeah, that makes sense. They already learned a lot of this stuff
yeah.
in the past.
So and you can see a lot of those classmates because sometimes they don't want to go through the MD route in the States. Um, but that would be the only scenario that I saw in my class that they were able to work. Other than that, um, you're also through clinicals, those are 8 to 5s.
Right.
And on the weekends, you're studying.
Yeah, I would imagine so.
Yeah.
Yeah. Uh, Another question, do you recommend applying to a school that does not help you with site selection with preceptors during your clinical year? Some schools nearby sound good in their mission statements, but that you have to find your own placement during your clinical year.
Unless you're very familiar with the area and the community and you know where to look and ask, um, that would be a good option for you. But if you're going out of state, I think the program assigned clinical rotations are the best because that's just going to add added stress to an already stressful situation. So I would definitely go with programmed assigned rotations. There is electives, and those you can find your own preceptor for those. But I think it would be very stressful to try to find your own rotations. All
It
right.
can be done, but it just adds a lot of work because you have to be reaching out and calling and emailing and sending letters, and it's just a lot of extra labor for you.
Mhm.
I know that like DO schools also have that issue in the field of medicine, and during their fourth year, a lot of students have to reach out and find their own rotations, and they say it's stressful.
Yeah. So you graduate. So you have to do your boards, which is the PANCE. once you get your PANTS, you get your state licensure. For the licensure, you have to keep up with the CME, which is 100 CMEs in 2 years. And then you need to take your boards again in 10 years. In the past 10 years, there's more specialty credentialing. So if you want to focus on neuro or cardiology, there's credentialing testing that you go do through the NCCPA to credential you in those areas. So,
Speaking of the specialty, I'm curious, how did you land in the field of infectious diseases?
um, a friend told me about the job opening. They told me because I looked at it and I was like, I don't want to do ID because when I worked as a respiratory therapist, when the ID would come by, I'm like, oh, I do not antibiotics, no. Um, so they told me, oh, it's the HIV clinic. I'm like, okay. Um, and I applied, and it's a population that I've wanted to work with. Um, it is an underserved population, so I found that job and I really enjoyed it. But my plan was to be um, primary care or OB.
Interesting. Yeah. How is it that once you got that job, how did you get comfortable caring for HIV patients? How long did that take you? Did you have supervisors in that job that kind of helped train you?
Yeah, so with the PA, a nice thing is that you can do different specialties. For me, credentialing, when you go through Medicare insurance and all that, at the U, it's like a 3-month process. During that process, um, I shadowed another PA. I shadowed the ID doctors. So I did 3 months of shadowing. I don't know if that's going to be available at at each clinical site, but that's what helped me. Um, my attending, we were in the same area. If I came across something, I would just ask questions. Um, and then for me, there's also a HIV curriculum. So I went through that. There's certification for a HIV specialist. I went through that. But the PA profession is a lot of on-the-job training. We're trained as generalists, but when you start working, that's where you kind of hone in your skills.
Yeah. And I mean, that probably happens in a lot of different fields in medicine where it's like, for me, I was trained as a general pediatrician. And yes, I had done a lot of hospital work and NICU and specialties. But then it wasn't until my first job that I was like, okay, this is the day to day bread and butter of this job. And that's when I got really comfortable with that. So whether, you're a PA or an NP or a physician, like you're going to learn the skills of that particular job kind of as you go as well. There's another great question in the chat. She says, I have been able to go to some Q&A sessions with nearby school admissions teams. And whenever I ask about careers after graduation, they don't really have like a lot of helpful information. Did you find it easy? Did you find it easy to navigate finding a job after PA school, or did your school offer any support?
I I graduated in August of
Mhm.
2017, and I started my job in January. A lot of people start applying for jobs before they pass their boards. I think that's probably common for, is it common for MDs?
Yeah, that
Yeah.
it is.
I was one of the people that chose not to apply until I passed my boards. Part of it is because I have test anxiety. So that's what worked best for me, but you can start applying probably mid-year of your clinical year. Um, but depending on where you're applying, it can be very competitive. I knew that I wanted to stay in Salt Lake. So that's probably why it took me a little bit longer to get a job.
Great. Great questions, everyone.
Um, what was I gonna say? Any other questions?
Not at this point. You can continue.
Okay, these are the resources that I have. The AAPA, it does a whole presentation on how to become a PA, and it has resources on there. And then the PAEA, that one gives you the application cycles for the schools.
Excellent. There's also just so much more out there that didn't used to be out there on YouTube, on the internet. Some places will post like sample personal statements for you to read through. Students who have been through the process will sometimes share, their application tips. I would say go out there and look at that information, but don't look at it so much that you create an anxiety disorder in yourself.
Yeah.
There's kind of a balance. You always want to filter things through your own experience, your own lens, and the lens of your mentors. I have one student that I mentored a while back, and she would just go out and read all of the Reddit threads and read all of the websites, and then she would find advice that was contradictory to what I had been advising her. And I really was like, look, okay, the people who are posting out there don't have all the same experiences. I said, I've mentored dozens of students. I've worked on an admissions committee for 5 years. Like I trust, some of that. So make sure you kind of try to weigh the expertise of the source that you're looking at, is my point, because you are going to find, if you ask 10 different people to critique your personal statement, you're going to get 10 different opinions, right? And that's just part of the nature of the game. But you want to prioritize advice that's coming from people who have actually had more experience in that particular field, because like I said, you're going to ask 10 people, you're going to get 10 different opinions, and it can get really nerve-wracking when you're getting conflicting opinions from different sources. So try to find a mentor if at all possible through this process, and rely on that mentor if they have more experience.
I echo that.
Yeah, there's another question for you. Alba says, are you part of any organizations that you use to support your career growth as a PA? Are they local or nationwide?
I am not a part of any organization locally or nationally. I think you get to choose what you want to be involved in. Like I'm involved with the Latino Physicians of Utah, that provides an opportunity for outreach. At the university, I am the lead APC for our clinic. So there's opportunities to come across, and you can take them. You can look into the national organizations or the local organization, and if you want to go that route. I feel like I'm more patient-centered.
Yeah, I think it also depends on where you work. If you work in a really small community clinic that is not well connected to, a big hospital or a lot of other professionals, then it's probably going to be more important for you to be part of a national or statewide organization that helps to support you, because you don't have that support through your workplace. When you work for a really robust organization like the University of Utah Health System, then you have access to conferences through the university. You have access to a lot of other physicians and PAs and NPs that are working in the infectious disease world. You probably do go to conferences here and there in order to maintain your certification. So it just kind of depends on where you work and what level of support you feel you are already provided through your work versus how much you have to reach out and find that for yourself.
Another thing that came to mind when you're out there looking for a job, one of the big things that I wanted is those resources, especially like up to date, or to look at like medication interactions, because if you go to a private clinic or a small clinic, you might have to pay for those. So like these organizations, the university systems, those will be provided to you. So I knew that's something that I wanted. So when you're at that point, you can look at those things and then know what fits your criteria and then apply to those jobs.
Yeah, Absolutely. Yeah. The bigger the organization you work for, the more perks they're going to provide. That doesn't mean that a big organization is always the best. There are pros and cons, and you have to determine based on your personality, your priorities, what works best for you. Obviously, location is important for a lot of people. And so if you want to be in a big city, that's one thing, versus if you want to be in a smaller community, that's another. Great questions, everyone. I have a few last questions for you. I'm curious, what do you really love about your job as a PA?
The patients, and I love that. Well, I think when you work in a group, you bounce off ideas, but I can go into our workroom and ask the doctor or ask one of my fellow PAs, hey, what do you think about this? Um, I feel like um I my like what is the wording? Um like I can always reach out to my attending if there's something that I don't know. And in reality, it's like that across um, PAs and MDs. Like you're always working on as a team. So so you bounce off ideas. But I really like working with the patients. I like where I'm at, but there's a lot of flexibility if I wanted to go to another specialty.
Mhm. Yeah, that's amazing. Thank you. And then second out of three questions, what are some of the challenges, maybe the real day-to-day challenges of being a
Um, the real charting, charting and keeping up with your charting. Um, insurance, if a medication is covered or not, and the insurance company is telling you that they should be on another regimen when it's not appropriate. Um, and then the other thing that I've really worked on is boundaries, and that is boundaries across the board. Um, and also like if your patients are late, you have to look at it case by case, but boundaries there because you also want to go at the end of the day and relax. You want to go home at 5 or whenever that is. And I don't want to stay there late. So I think that's one of the biggest things is boundaries across the board.
PA?
And um, and learning how to say no.
Yeah, I would say that those are probably the challenges shared by any clinician in modern day healthcare. Absolutely. And then last question for someone who is on the path to becoming a PA and maybe they're feeling a little discouraged or they're like, oh, is this worth it? Like, do you have any parting words of advice for them to kind of stay motivated on this path?
I would say find a mentor and really explore that why, having that patient interaction. Um, I think that's going to reignite why you want to do it because um, I can see how like you could be burnt out about the process because it's hard, but remembering at the end of the day why you want to do it. So getting out there and volunteering or shadowing and seeing that patient interaction, I think would be helpful.
Mhm. Excellent. Well, thank you so much for this excellent presentation today. I learned some things. I know our audience learned some things and had some great questions. Thank you for your responses to all those questions. We hope everyone learned something today and was a little bit, I gained a lot of gained at least a little bit of motivation on their path. Um, we hope to have more of these. So if you have ideas for other topics that you'd like to hear about related to medicine, PA school, anything within the health professions here in Utah, we'd be happy to try to put that together. Thanks everyone for attending and have a wonderful day.
Thank you.